Today, we are diving into a really powerful work by psychoanalyst Christopher Bollas called When the Sun Bursts. Now, this isn't your typical clinical manual. Not at all. Think of it more as a journey, a deep dive into one of the most mysterious and, honestly, deeply human experiences there is, schizophrenia. Bollas's whole approach is about listening, about trying to understand a person's inner world. He's asking us to look past a simple diagnosis and actually step into the reality of a world that is completely different from our own.
So where do you even begin to understand something like this? Well, Bollas frames schizophrenia not just as an illness that needs to be cured, but as this enigmatic existence, a state of being that really pushes the absolute boundaries of what we even think of as perception.
I mean, just listen to the intensity of that statement. Bollas isn't talking about some abstract patient or a case file. He's describing a person, a human encounter that is so compelling, so captivating that it challenges the analyst on every single level.
And this right here is the crucial point. Bollas argues that these conversations aren't just with someone who's lost in, a fog of symptomatic preoccupation. No, it's an encounter with a person who is experiencing a genuine, though totally different form of perception. Some people take a drug to see the world differently. The schizophrenic sees these things with no aid at all.
Now, this kind of understanding didn't just happen overnight. Bollas himself had to go on a journey, had to learn an entirely new way of listening just to even begin to get a grip on the logic of this other world.
Early in his career, someone gave him this piece of advice, and it became the absolute foundation of his work. The natural impulse for a therapist is to interpret, to analyze, right? But he learned that had to take a back seat. The first and most important step was to just absorb the patient's reality as they were experiencing it.
So let's break that down because it's really important. First, you just listen and absorb. That's it. Second, you really work to grasp their worldview from the inside out. And then third, and this is the key, you mirror that understanding back to them. Now, this isn't about agreeing with them. It's about validating their experience, letting them feel, maybe for the very first time, that someone actually understands their world.
Okay, so to see how this actually works in practice, let's talk about a specific case from Bollas's early career. This is the story of a young man he calls Nigel.
Nigel had this incredibly imposing presence. He'd been referred from a university because he was, as they put it, emitting violent vibes. So just picture this guy, 6'5", blonde crew cut, these piercing blue eyes, and he's dressed head to toe in black. He shows up for his first session, sits down in the waiting room, and just starts cracking his knuckles.
He doesn't even check in. He just sits there, staring straight ahead. And within seconds, the entire waiting room is cleared out. The other patients are nervously waiting in the hall. When the secretary finally works up the nerve to ask if she can help him, he delivers this line with what Bollas calls his best android inflection. I mean, the encounter had already begun before he even walked into the office.
Nigel's story is definitely unsettling, but Bollas shows us that for many people, the experience is even more catastrophic. He makes this point that schizophrenia often isn't some gradual decline. It's a sudden, world-shattering event, a single moment when reality itself just breaks apart.
He puts it this way: 1 minute, life is completely normal. The next, it's the apocalypse. And even if the first signs are small, a strange feeling, maybe a voice, that person never, ever forgets that first moment when their world was fundamentally changed forever. To really get the gravity of this, Bollas tells the story of another patient, David. When Bollas asked him how he knew something crucial had changed, David's answer was just chillingly simple. It happened when he was only 10 years old. So what on earth did he experience? This was it. One day, during break time at school, David ran out of his classroom. He felt something was different. He looked up, and the sun burst. Just imagine that, a full-on apocalyptic, world-ending event happening right there in the sky. He ran back inside and hid in a closet for hours. And here is the absolutely devastating consequence. When the teachers finally found him, they were just angry. They thought he was playing a prank. But for David, the event was completely real. So if the adults around him hadn't seen it, it could only mean one thing. They were lying. They had to be in on it, part of some conspiracy connected to whatever forces had just burst the sun. And at one single, terrifying moment of perception, and the betrayal he felt right after, it reshaped his entire existence. His logical conclusion was that he had to protect himself. He had to shut himself up and remain absolutely still. And he did this for a decade. 10 years. So, what are we supposed to take away from these incredible stories? Well,
Bollas's work points to a really radical conclusion, that within all of these seemingly chaotic experiences, there is a logic. It's a different kind of logic for sure, but it is a discernible one.
This is the core concept right here, discernible logic. It's this foundational belief that nothing is truly random, that if an analyst is patient enough, and, this is the important part, willing to meet the person where they are on their own terms, then the internal logic of their world can actually be understood. And that really leaves us with this final, powerful question, doesn't it? This is why Bollas's work matters so much. It suggests this profound shift in how we might think about mental illness. Instead of seeing a broken mind that needs to be fixed, he sees a different mind that needs to be understood. It challenges all of us to consider that maybe, just maybe, the first step toward connection, and maybe even healing, isn't about imposing our reality on someone else, but about having the courage and the humility to enter theirs.